and welcome to News Channel 12.
Today we have a special report on global diseases.
We're going into depth about all types of diseases.
We'll even talk about prevention.
There are two types of global diseases. First is non-communicable, which means you cannot spread it. An example of this would be heart disease. And then there's infectious, which means you can spread it, like the flu.
In high-income countries, diseases such as heart disease, cancer, and diabetes are more prevalent than infectious diseases because of the higher-income countries have more access to vaccines. Also, these non-communicable diseases, such as heart disease in America, has a direct correlation to the poor diet choices.
In low-income countries, the most common infectious diseases are malaria, diarrheal diseases, HIV/AIDS, tuberculosis, and Ebola. Many of these are due to an insufficient health care, unclean drinking water, and a lack of education.
According to the World Health Organization, in low-income countries, 4 in every 10 deaths are among children under 15 years old. 2 in every 10 deaths are among people over 70 years old. 6.6 million children died before reaching their 5th birthday because of birth trauma. 99% of childhood disease deaths occurred in low and middle-income countries. 43% of deaths occurred within 28 days of birth. In high-income countries, 7 in every 10 deaths are among people 70 years and older, and only 1 in every 100 deaths is among children under 15 years old.
Oh my gosh, they have Ebola.
Stop, have no fear, Ebola is not here. If you're living in the U.S., Ebola is not a threat to you.
Here's why. Ebola is not an airborne disease. You need to come in contact with the bodily fluids of someone carrying Ebola.
There have been few cases of Ebola in the United States, and all have been treated under the strict supervision and care of hospital quarantine.
Although Ebola is not much of a crisis in the United States, the disease is very much prevalent and dangerous in Western Africa. The CDC has reported over 6,000 deaths so far.
We've given you a lot of information on global diseases. Now we will cover prevention. First, how to prevent infectious diseases.
In many low-income countries, infectious diseases can be acquired through contaminated drinking water and food, along with unsanitary conditions. Germs can be spread through coughing and even sex, both of which are the sharing of bodily fluids. So the message that can be taken away from this newscast is to wash your hands regularly and use condoms.
Here are some ways to prevent non-communicable diseases. Taking simple steps to prevent heart disease and strokes will be helpful in the long run. You can maintain a healthy lifestyle by eating healthy and exercising daily. Physical activity can help you maintain a healthy weight and lower cholesterol and blood pressure.
Cancer is also a non-communicable disease. A few types of cancers that can be easily preventable are lung cancer and skin cancer. Smoking is one of the leading causes to lung cancer. For skin cancer, wearing protective gear when exposed to radiation is key. Long-sleeve shirts, sunscreen, hats, and sunglasses are ways to protect yourself from the sun.
Thank you for watching News 12 special on global diseases.
Stay tuned for our broadcast on Dr. Blair's cancer research breakthrough at Yale tomorrow.
Signing off!